autograph it for you, I'm sure. And Chris, if you would, you could tell the members of the audience how to obtain one of these. Fine book.
Well, I don't really know how to get one. You can get one from the GPO. I don't have the address right now, but if you write the GPO and give them the title of the book, they will be happy to send you one. Actually, I'm kind of prejudiced. I mean, it took me a long time to put the pictures together. I think that many of you have seen the book. It's only $14, and what can you buy these days that has 287 color pictures for $14? So if you have nothing else to do and you need some light reading, get one. I'm interested. Well, I love the building we're in. I've never talked in such a nice place. People ask me what I think about it, and I said I think it's too nice for a bunch of vets. But no, it really is nice. I like the idea of the scopes in the back of the room. And you people that are studying other cases and don't care about parasites, continue. But I promise next year that I will bring unknown parasites so you can study that while you hear me talk. Today, it's going to be hopefully a good time for you as opposed to mostly taxing your brain. I hope that you don't try to take notes when I talk. I ask, why do you people have me back every year? Because, I mean, aren't people tired of hearing me talk? But I do see a lot of new faces. I think it's mostly to get the new residents at AFIP used to the way I talk. I don't think you can take notes when I'm talking, if you people have ever heard me talk. I want you just to kind of look at these parasites and get a feeling. I want you to get a feeling that it's not that difficult. And you say to yourself, well, the man is crazy. He's been doing it for 20 years. Yeah, it's not difficult for him. Well, many cases are. Don't kid yourself. But if you get some basic knowledge, you can then get references, and then you can use that to make your identifications yourself. I believe that there is a handout in your packet, and these are really all the salient features you need to identify parasites. Now, we will start off with the first hour or so about talking about protozoans. And I have 174 codochromes to show you. And then we will take a break, and then we will come back for worms, which I like a lot more. And then I will show you 230 pictures of worms. And then I'll show you recent advances in veterinary parasitology, if you will. So if we could have the lights, please. Oh, and if you'd like to ask a question, and you can stop me from talking, just go ahead. Okay? Okay, leishmaniasis. And I may say that most all of these codochromes have companion pictures in the atlas. All right? Now, we're going to spend time with the groups of protozoans that, you know, are much more, say, important, or there's more salient morphologic features that you should dwell on. Such is not the case of leishmania. The flagellates. You know, if you take a smear of an animal infected with a visceral form of leishmaniasis, many times you're going to get macrophages with massive numbers of amastogotes. And is this an easy diagnosis to make? Yes, relatively easy. You know, you're going to look for that kinetoplast, which is, you know, somewhat basophilic, with a reddish nucleus and a cell membrane. Now, when you look for these little boogers in tissue sections, it's often much more difficult. The reason being is, you know, there are only a few forms that form massive numbers of organisms in the tissue. Most of them only have a few, like shown here. And that is an amastogote. You say, where is the flagellum? Well, as you all know, it has it inside the cell, and you really have to do electron microscopy. But what you're going to want to look for is an organism, a little round thing, that's 2 to 4 micrometers in diameter, has a nucleus, and has a kinetoplast, that little dark body right there. Now that's leishmaniasis. I can't help you any more than that. Now, trypanosomiasis, I don't do blood smears well, but there's different types of trypanosomes. You know, everybody thinks that all trypanosomes look like T. cruzi, you know, in the shape of a C. Well, I hate to tell you that many trophozoites of Trypanosoma cruzi are not C-shaped, number one. But number two, there are a lot more species of it that kind of look like these fish with these little fins. Enough said about that. We're here to do histopathology. And here is heart muscles, and it's very difficult to miss this diagnosis, people. This is low magnification, this is high magnification. And you know, some people say, well, you know, I have a hard time differentiating a trypanosome from a leishmania. Well, it really isn't that difficult, because look at this organism. It kind of looks like leishmania, they're first cousins, if you will, but the kinetoplast is maybe twice as heavy, you know, much deeper staining, and the organism is 1.5 to 2 times as big. So it's another world, people. You know, when you go from 2 to 5, I mean, that's big. Okay? So that's our trypanosomes, and you're going to find that in heart muscle. You know, they get into ganglion cells. Good luck in finding them. Now, Giardia. Now, if you do fecal smears, if you study diarrhea like me, you know, some people get excited that they can make the diagnosis of a Giardia Trophozoite that it has 2 eyes looking at them. It doesn't excite me anymore. It did 20 years ago. But in tissue section, now this is tissue section, and look at the little eyes. Notice that the iron hematoxylin doesn't take up too well here, but certainly the Giemsa does here. So you can look for a binucleate trophozoite to prove to your friends that you have Giardia in this canary. Here they are. They're kind of plastered against the microvillar border. They're basophilic, and you know, you people who can count the number of flagella on a tissue section, welcome to the 21st century. But it's very difficult. It's an easy diagnosis to make because usually you can find a trophozoite. When you get to little boogers like this, which is supposed to be spironucleus, how do I know? Because I said it was, and nobody has ever argued about it. But look, these are little kind of crescent-shaped to round with the one nucleus right here. You can't see any of the flagella. So, you know, residents bring me crypts of all kinds of animals, and of course it's filled with not only mucus, but a lot of shit. And you know, and they see these little round things and they want to call them flagellates all the time. I would just caution you that, you know, there's more things than flagellates in intestines. But if you see a lot of these which have similar shape and a nucleus, I think you can say. Now, spironucleus, yeah. If you told me it was another type of flagellate, I'd say, okay. Here's a stain of Trichomonas, and you can see that nice little undulating membrane. But how many times do we look at these things? Not very much, if you're doing pathology especially, but on tissue section, you can see here's an organism which is much larger than that spironucleus, but here's a large one nucleus in it, so it's not Giardia, and look, you can see the little blips of the flagella as it passes on the undulating membrane. So you have an organism and you measure it with your ocular micrometer, which I'm sure all of you have in your scope, and you can find that that's probably Trichomonas. Histomonas, do you ever see a flagellum of Histomonas? Well, if you're doing fecals, but if we're doing histology, you really don't. Here's the liver, and I think most people make the diagnosis by seeing a liver that's filled with necrosis. The first thing they do is they order a PAS, and then they start seeing not only a darker liver, if you will, because there's, I guess, a lot of lipid in these things, but there's some organisms. Here we are in H&E, and you know, if you would describe the morphology of that, you'd say, you know, I see some things that are about 10 micrometers in diameter. They look roundish, and there's like a nucleus. I guess that's a nucleus. That's the best you can do on Histomonas in tissue sections. You just really can't sink your teeth into them. And then, you know, there's the guy who loves those AFIP special stains. Here's an intestine, and that's where the organisms are. You really can't see them well, but then you start seeing these reddish things on a PAS stain, and of course the H&E vice the PAS, and you say, well, this is great because I can hardly wait till I see necrosis again in a turkey because I'm going to get a PAS. People, they're not always PAS positive, okay? I found it works in about 75% of the cases. And why it doesn't in the other, don't blame your technician. I don't know. But it's just like a little basophilic nucleus. Like I said, no flagellum. They seem to be kind of sequestered here in the parenchymal cells, perhaps more than one because of binary division. Now, Entamoeba is another story. Entamoeba, everybody knows Entamoeba histolytica. It is, of course, not uncommon in man, but the trophozoite usually has a kind of a stippled cytoplasm, but the nucleus is the thing that gives the organism away. The nucleus is somewhat small, but there are peripheral chromatin plaques around, and right in the middle is either circular or a little dot, an endosome. Now that is characteristic of an Entamoeba nucleus. Okay? So this one is from a monkey. Is it easy to find in a monkey? No. And you people that find all these livers with necrosis and you say, well, it's caused by amoebiasis, well, it may be. The organism is difficult to find. All right? Entamoeba invadens is another story. Usually your reptile will be just jam-packed with these things. Now, I found, look at this lovely nucleus. It has peripheral chromatin plaques and that nice little dark endosome. I found in Entamoeba invadens, it always seems to be a very mobile trophozoite as opposed to this. Look, all of the cytoplasm is over here because the pseudopodium is going that way. Okay? So that is something that you find in almost all of the trophozoites. Here's another one. You see, we really can't get a good picture of that nucleus right there, but look at those pseudopodia that are going to go. Now, this organism is to be contrasted with our free-living amoeba. Now, how do we tell the difference? It's one of the easiest differentiations you can make. Remember that endosome in the Entamoeba nucleus is a little pinpoint, perhaps sometimes circular. All right? Look at the endosome in your free-living amoeba. It's huge. It's taken up half of that nucleus. You really can't see any plaques, although sometimes it's difficult to see. But your free-living amoeba, be it Acanthamoeba, Naglaria, or some of those strange other names that they're coming out with, they all have that large endosome like that. And all of these will occur in tissue, and that's how you can tell the difference. Another phylum now from the flagellates and the amoeba are the Microsporidia. Now, unfortunately, everybody focuses on encephalitozoan. You know, you say Microsporidia, they go, I know all about that because that's encephalitozoan. Well, there's a lot more genera and species than encephalitozoan. Here's a Microsporidium in a snake. And notice, this is H and E, and there are small forms, kind of in packets, and then there's some larger forms with some basophilic bands. These are the mature spores. They're kind of hyaline. I never use a polarizoscope. I don't know how to do that. Of course, you people don't use oil or ocular micrometers. But anyway, sometimes you have this basophilic band right here in the mature spore. What I like to do is, if you think you have a Microsporidia, get a tissue gram stain. Now, this is a brown in hops, and it stains things both positively and negatively. You'll see that the vegetative, the younger forms, are darker bluish, whereas when they get bigger, they turn out to be a little bit more pink. But these are all stages of the Microsporidium. And here, the mature spores are acid-fast, and the ones that are still growing, doesn't have the spore coat, if you will, are not. Now, this is encephalitozoan right here. Look at the difference in the sizes. This may be 6 to 7 times as big as this. Now, you can't make the diagnosis of encephalitozoan in the brain or the liver of a rabbit, unless you use this tissue gram stain. Yeah, I've seen them, you know, but I've had serial sections and I knew where they were from the tissue gram stain, and I've gone back to see, can you see it on H&E? It's difficult. But if you think you have encephalitozoan, go ahead and get your gram stain. Notice there's no reaction around this. You know, they don't have reactions unless these clusters kind of pop, and then the reaction comes. So it's a big help. Here we go. This is a fish gill. You knew that. This is an endothelial cell, H&E, another different type of microsporidian. Notice how it's caused hypertrophy of the nucleus. Here's our tissue gram stain. Notice how you can really see it a lot better. Here's H&E. This just looks like a group of something. Can you really tell? No, not really. This is in a lovebird. Another stain that I use for microsporidia is a PAS. Now, it's not going to make the whole organism reddish like we did for those Histomonas, but you will see that at one end of the organism, it is brilliantly PAS. And you're saying, I need to have my eyes checked, and I'm saying, look at the picture in the book. But anyway, this is brilliantly red right here, people, okay? And you see that little band. But that little red thing is where the filament, which is in a polar capsule in the spore, that's where the filament is going to come out. And evidently it has some lipid that is brilliantly PAS. But, this helps people like me when you want to make a diagnosis. So you get a PAS, and it's really the only thing that I know that has that tiny little dot that is PAS positive. So try it on the next thing and impress your boss with that little piece of information. Electron microscopy, many times people scream at their technician because he has all these holes in the paraffin, when in fact it's very difficult to impregnate the thick spore wall of a microsporidian. And here they are, and I just wanted to show you, this is a spore. This is the filament. Remember that it is coiled around the nucleus, and it'll squirt out here. So this is the thing that is PAS positive. But the way that we get the genus and the species is counting the number of coils. They say Encephalotozoan has 4 to 7 coils. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3. So it's coiled like 7 times. So this possibly could be Encephalotozoan. But if you get something with 3 or get something with 12, it's not Encephalotozoan. I can't really do much more than Encephalotozoan or other ones like that. Here's their first cousin, another phylum, mind you, and this is in a fish. This is normal muscle, and you have these big masses of spore or something that seem to be protozoans. And here we are on H&E. Okay, we see some kind of hyaline-looking things, but you really can't get any feeling for the morphology. But I like to use Giemsas on the Myxosporidian. That's what they are. Okay, here are the polar capsules that have the filaments in it. Myxosporidia have 2. Sometimes they have more, but I've only seen them in 2. But you get a Giemsa, and it's really very nice and blue. The mature spores are acid-fast. Yes, I've tried to stain everything in the world with acid-fast. And sometimes they're not round to oval. Sometimes they're elongate. And look, this is in a fish gill, and you have these elongate things. A nucleus really can't tell anything. But look how nicely it'll stain. And these are the polar capsules that are very blue with Giemsa. Those are your Myxosporidia, and they occur in all kinds of fishes and reptiles and amphibians. Balantidium coli. Now we move to the ciliates. Did you think we were moving this fast? Actually, I'm going slow today. Balantidium, nobody misses the diagnosis. I mean, you have a pig, you have these things, it has these big black things, and it has cilia, and you just know it's Balantidium. Well, yeah, it's an easy diagnosis. The cytoplasm usually is dirty. It's filled with foodstuffs. You can see cilia on oil magnification, and then there is that kidney shape, or heart shape for you lovers, macronucleus, okay? That's Balantidium. And, yeah, you can see cilia when it's out of tissue. It's sitting there in the lumen. But what if it's surrounded by this gunk, tissue or whatever? Can you see cilia? No. I'm sorry. You cannot. But you can see that nice macronucleus. And let's remember there are more ciliates in the world than Balantidium. Ick in fish is a ciliate, but notice you really can't see it there. But look at that nice kidney to horseshoe-shaped nucleus. And other ciliates that occur in the rumen of horses. We always get these cases that people say, hey, I got a new organism for you. It's this horse. It died in Idaho. I posted it. Yeah, I posted it in the field. Yeah, I got some feces on it. But anyway, I got these wonderful organisms all in the lungs. Well, the poor horse, I mean, he either some feces got involved with the lung, or he slipped some into the lung, and here's this organism that they now want to, I guess, name after me, which would be nice. But anyway, it has tufts of cilia here, and if you're lucky enough, you'll get a nice macronucleus. This is this little mouth, and this kind of looks like a pirate. That's why I always use that one. Pneumocystis. Pneumocystis, I don't know what to do with pneumocystis, people. First, it was a protozoan. Then, remember, it became an algae. Then it was a fungus, and now it's a protozoan. It's only a protozoan because protozoologists do not argue. You want to give me something, okay, we call it one of ours. I guess, justifying their existence. The diagnosis on pneumocystis is made. It's a histological diagnosis. I mean, what other disease causes this eosinophilic gunk that's foamy in the alveoli? I don't know of anything really. Of course, I'm not supposed to do pathology, so if I tell you something wrong, don't blame me. What I tell you about pathology will be on no boards. But anyway, here's a higher magnification, and it's dead organisms, it's dead inflammatory cells, it's spit, it's all kinds of stuff. But here we are, you use a GMS, you use a fungal stain. That's why it was called a fungus, because it's stained with a fungal stain. But anyway, here are these little black things, and here they are, pneumocystis. I think they quit asking about that years ago. But they have not quit asking about the apicomplexum, the coccidia. Now, the coccidia are probably the most complex group of protozoans that you're going to find in tissue. Although many of them just stay in the digestive tract, they can cause lots of problems. Now, from listening to me today, you're not going to really learn how to differentiate between Eimeria and Isospora and Sarcocystis. You'll know how to do Sarcocystis. But I'm not here to tell you how to differentiate. I'm here for you to appreciate the morphology of the different stages. Because if you can't tell your contributor, well, your case is just loaded with macro and micro gametocytes. I see an occasional schizont, and the schizont is very small as opposed to the large one that could have dropped down into the lamina propria. That's what I hope to pass on you today. That's the kind of thing you want to learn. Then you can read up about coccidia and see which ones have the large schizonts. But we're used to coccidia, sure. Why is it? Well, there are oocysts that pass in feces. Now, can you see that in tissue section? This is tissue section, and that's an oocyst. And you all learned that about all of that in vet school, I hope. Well, I also hope that they taught you the different stages of the organism, because if you don't have a basic understanding, even if you read about it, you won't know what you're reading. So, the stages are macrogametocyte, which is a female, micro, which is male. All right, we'll start with the sexual cycles. I always begin things with sex, and I'm not going to tell a joke about that right now. Anyway, this is a macrogametocyte. This thing, the female, will later form a cyst wall and become an oocyst. Okay, so the macrogametocytes are oval. They usually have a dark reddish nucleus, and you will see in other species, as opposed to this one, will have very eosinophilic globules in its cytoplasm. Now the males, the microgametocytes, are most times larger than the female and usually dark to granular in appearance, but when they mature, they form some sperm-like bodies, microgametes, and one microgametocyte, each one of these being a microgametocyte, may form hundreds of microgametes. And then they go, like sperm, to go and hit one of these macrogametocytes. Let's think in three-dimensional kind of thing, people, because, this is right next to it, but don't kid yourself. These things have to leave, go into the lumen, try to find one of these and penetrate. It's not as easy as it looks. Well, you can just travel through here. Good luck. Anyway, macro and micro. Look, more examples. This is a microgametocyte. Each one of these little nuclei will turn into a microgamete. Here is our female. red globular material, and you'll see when we go to arthropods, and you will see when we go to nematodes and trematodes. Eosinophilic gunk is usually associated with a female, usually yolk. All right? So this is kind of a female thing. These bodies, these oocyst-forming bodies, when the macrogametocyte is fertilized, these bodies move to the periphery and form the oocyst wall. That's what happens. All right? Look over here. This is a macrogametocyte, and that's a macrogametocyte. That right there is a microgametocyte. And this thing that has these little bananas, these little long kind of things in it, is a schizote. This is an asexual stage. So everybody's heard about trophozoites. They're just kind of like a little amoeboid thing. The trophozoites then grow up and have meiosis and mitosis and form your schizotes, your asexual. And these pop out, and then they can either do another one of these stages, or each one of these merozoites can form your sexual stage. So those are the stages that you normally find in the intestine. Sometimes those schizotes, remember that schizote that I just showed you? Very small within the epithelial cell itself. That's small. This, people, is big. This is a schizote. You're saying, well, you just told me schizotes are in epithelial cells. Yes, but in some cases they drop down into the lamina propria and form these huge megaloschizotes. So when you read that Eimeria ovina produce megaloschizotes, now you're going to know what a megaloschizote is. But anyway, these are large things, and then look at all these little bananas, and this is an asexual proliferative form which will pop out and then form the succeeding stages. Coccidia are found within epithelial cells, like I told you, and this is a massive number of macrogametocytes and microgametocytes, and they can be either of the sexual stages, or sometimes in your host you can get an asexual stage, usually not within the epithelial cells of the intestine, but any tissue of the body. This is Besnoitia, but anyway, these, if you had a little bit higher magnification, would see that they're banana-like, just like those bananas, if you will, of the merozoites and the schizotes. Now, you look at this chart and you go, oh, thank God, Cryptosporidium, Caryopsora, Eimeria, Besnoidia, all of these things are different. Well, yes and no. To really get the genus and the species that you're dealing with in Coccidia, you need to take one of those oocysts that are passing out in the feces. You want to sporulate them, usually in potassium dichromate, and then instead of just being amorphous, if you will, they will then round up into some sporocysts that have sporozoites, and they form different arrays. Sometimes you get two big things with four. We won't go through that. You learn that in vet school, hopefully. But anyway, I would just like to point out Eimeria, which is here. You've probably never seen Calyptospora, but Eimeria can be differentiated from these others. Unfortunately, look at this. Toxoplasma sarcocystis, Isospora, and Besnoitia, which are very common, all are going to look the same in feces. Many of the Coccidia direct cycle. Here, you get this, you eat it, it does the stuff in the intestine. This is the cycle of Eimeria. By the way, these are some plates from the book, if you want to study these kinds of things. And we go through all of the genera showing how they differ. That's what happens when you write a book with people at USDA that are Coccidia experts. They think that those are the most important things in the world. Sometimes I do. Anyway, nobody, I don't think, has ever missed this diagnosis. And of course, this is Eimeria in a rabbit liver. I mean, it's a pathologic diagnosis as opposed to morphology. Many veterinarians do that. And we'll get into the vet game later when we go into the worms. Remind me to tell you the vet game if you don't know what it is. Well, let me tell you now. The vet game is, and many of you know what the vet game is, this is how we diagnose what parasite we have. You have the animal and you have the organ, and you tell me what the parasite is. Don't worry about the morphology. That's the vet game. All right? We see, I look at these cases a lot differently. I like to look at the morphology of the parasite, and I could care less what animal it's in or where it is. Okay? I mean, I play the vet game good too, but remember, let's go for morphology. You know, you'll have to promise me before you walk out the door that we're going to go for morphology of the parasite as opposed to the organ and the animal. But let us move in here. Look at this. Now, you people are starting to learn your morphology of your coccidia. You see these massive numbers of macrogametocytes. Huh? Look at those eosinophilic globules on the periphery. And look at these micros, which are vesicular. That's, you know, sexual stages. Here they are. Look, micro, macro, right? And look, an oocyst. And now you'll all think you're going to be protozoologists. This, however, is the bile duct of a snake, a racer. And I just throw this in so you people will not focus with what, you know, is all published and what you're taught in vet school. You can use that same information to diagnose it in any animal. I mean, here we go. Look at this lovely schizont. Look at those little bananas, huh? Here's a macrogametocyte, and your microgametocyte is forming right here. So this is some type of coccidian, probably an Eimeria of the bile duct of a racer. And if you know, tell me later. Anyway, look at this. Macrogametocyte, microgametocyte, and remember when I tell you they turn a little sperm-like thing? And there they are. Huh? These are all the little males. Macro, micro. Notice where they are. Are these in the epithelium? They can't be in the epithelium. They're huge. This is a wonderful protozoan. This is Eimeria ovini. And you remember those big megaloschizont's I showed you in the lamina propria in that section? Well, what happens is these asexual stages start off in the upper part of the intestine where they form these huge megaloschizont's. The megaloschizont's pop out of the intestine, and they're kind of mucoid, and they stick together. Okay? And so it goes down lower in the small intestine, and all of a sudden it ruptures. And all of the merozoites come out, and each one of the merozoites hits an epithelial cell. Look, these are little trophozoites. And what happens? This is normal intestine. This is a polyp. It's a patch. It's called an oocyst patch. And this is all hypertrophy of the epithelium due to the massive numbers of the parasite. Isn't that great? And this is an oocyst patch with the macrogametocytes, the microgametocytes, and then the oocyst. Huh? Isn't that a great organism? When I do my next book on protozoa, this is going to be the cover. This is, look at this. Look at the red of these macrogametocytes. Look at this huge megaloschizont's. Okay? You see, you're getting your stages now. But I put this here to remind you that sometimes these megaloschizont's can also be found in lymph nodes. They somehow break out into the lymphatic, and this is in an afferent lymphatic. So don't be fooled. Don't call this Besnoitia, which is an asexual of another different type of genus. This is the same thing as that, but can be found in the lymph nodes. This is a wallaby. I put this here just to show you the beautiful megaloschizont's that just ripped this intestine up. I think that this wallaby complained of a stomach ache, but here's one of these megaloschizont's with all those zooites. Notice, you know, we can't focus on the genus of these things really because it's very difficult to tell. So we're just looking at the different stages in the presentations. This is Isospora. How do you know? Because somebody gave it to me and infected the animal with Isospora. But microgametocytes, macrogametocytes, schizonts. This is a developing schizont. And Isospora, you know, we used to think it was like Eimeria. But all of a sudden, we had this new thing, Isospora serenii, in birds and finches, and they would go to the lamina propria of the intestine, go to all the organs, and they'd form these massive areas of necrosis, and then the macrophages and stuff would pick up these nice little organisms, and we picked them up in blood smears. And then all of a sudden, you know, you do your tissue electron microscopy, and you can find your apicomplexum. I don't really want to go into the morphology but these are micronemes, and you know your conoid, and something that we never expected to go visceral went visceral. So you know, always keep an open mind because we haven't seen everything yet. I like this because I just love that picture of that snake head. But you will probably never see this organism. This is Caryospora, which requires a snake and a rodent, rodent being the intermediate host. But the snake has some, having the sexual stages, the asexual and the epithelial cells of the snake. But you'll get both male and female. We need to have less light in here, by the way. But anyway, male and female in fibroblasts in the skin of the mouse, and then it forms this strange little sexual stage called a karyocyst. Okay, so you've now seen it. Cryptosporidium. I mean, I want to remind you that it was probably about 1976 that the first human case of cryptosporidiosis was diagnosed by a veterinary pathologist, because they were more used to seeing cryptosporidium in cattle and stuff. So, you know, human pathologists sometimes don't have the range or breadth of knowledge that some veterinary pathologists. But here are the stages, and I'm not going to dwell on cryptosporidium because everybody knows, you know, the oocyst, the oocysts are acid-fast, and here they are. You know, if you do a Ziehl-Neelsen, sometimes not only can you see trophozoites, you can see the oocysts that are acid-fast in tissue section. Because, you know, a lot of times people bring me cases and there's little globules of mucus here, and they think that they have a new case of cryptosporidiosis, and they get mad when I tell them that I think it's mucus. I mean, you know, get an acid-fast stain, and, you know, sometimes if you get that acid-fast thing, there's no question about it. One of the most interesting coccidia that has, unfortunately, one of the most complex life cycles is Sarcocystis. Sarcocystis, of course, has been with us for an awful long time. And the reason why it's been with us and noticed a long time ago is because, you know, a lot of animals, for example, ducks, cattle, and whatever, have these macroscopic sarcocyst in their muscle. I mean, I think we've all seen it. Sometimes they're microscopic. You really can't pick it up until you do a section. And these are asexual conglomerations, if you will, of the protozoan. Now, how do you tell the different species? Well, I'm not really here to go through that today. I mean, you know, they do EM for the walls, and I have a picture later to show you some of the EM of the walls, and they say, you know, some species have finger-like projections in the muscles and others don't. And, you know, I think that's a good thing for you to learn. But one thing I do want you to learn, it's one of the easiest things that you can take from this conference, is that the sexual stage of Sarcocystis, be it in man, be it in dogs, be it in raccoons, I mean, it's going to look like the other coccidial stages I showed you. Macrogametocytes, microgametocytes, oocyst, okay? With one very important exception. The oocyst of Sarcocystis are found in the lamina propria. This is the epithelium, epithelium, epithelium. Do you see these things in the lamina propria? Those are the oocyst, not the megaloschizots, the oocyst of Sarcocystis. And not only are they found in the lamina propria, they're sporulated. Remember when I showed you that picture with all the species of coccidia and said you had to use potassium dichromate? Forget it, Sarcocystis has taken that out. They sporulate already in the tissue. So when these things pass, they're ready to infect an animal. They're infective. They don't have to sit around for a week or so. Now, it's probably the only coccidian that you're going to see in your tissue sections is going to be Sarcocystis with sporulated oocyst in the lamina propria. And use it, people, because there's all kinds of cases I get, and people don't know that one basic fact. And they'll say, ooh, you must have learned that at POLA. And look, acid-fast again. Yes, I stay in everything acid-fast. And the mature thing, sporocyst, if you will, there are two sporocysts in every oocyst, are acid-fast. Here are the sporocysts. This is what's going to pass out in the feces. You see, the oocyst wall used to be here, but it's so thin it popped. And these things pass out in the feces. And I am sure you people know the life cycle a lot more than me. But if you will just let me recite a few things. When you eat one of those sporocysts, when you ingest one of those sporocysts, the sporozoites inside pop out, go through your intestine, and get into large atrial systems, you know, an artery. And here they are. These are developing schizonts, meronts, asexual stages, okay? This is not very mature. You see, it's kind of amorphous. And then this is starting to mature, and this one is almost mature. I made them pose, people. That's why it's so good. But anyway, these things pop out and get into mononuclear cells and then go into other blood, well, we'll get to that later. Here is that wall of Sarcocystis. Isn't this pretty with all your zooites in the inside? We're not doing EM today. We don't have time. But we go to a capillary where they do a second generation of asexual reproduction. Now, this is Sarcocystis in the intermediate host. And look at these things. Now, can you tell that Sarcocystis? Well, you know, it's a difficult diagnosis to make. It looks like a bunch of nuclei to me. Of course, it doesn't look like it's normal for this host. You do electron microscopy, and you'll define these developing schizonts, meronts, which it's called, in the cytoplasm of the endothelial cell with no vacuole around it. That's Sarcocystis. Now, the reason I'm telling you people this, there have been approximately 30 human cases of Sarcocystis. That's the cyst in the muscles. They're usually found post-mortem or due to some other muscle biopsy, okay? With the advent of AIDS, and which is, you know, very suppresses your immunological system, I feel that one day somebody is going to come into a hospital. You know, we know that the cycle happens in humans or you wouldn't get the cyst. We know that arteries were infected. These broke out. They infected capillaries. These broke out and they went to muscles, just like we know in the life cycle. But because people become immunocompromised, I believe within a couple of years, you're going to get the signal case, the first case of endothelial involvement, you know, a massive infection in someone who has no immunological system at all. And I believe it's going to be a veterinary pathologist that's going to help the pathologist make the diagnosis. The pathologist knows the cyst in the muscle, but that's not it. That's the only thing he knows. But we know that there are other stages, so keep your eyes out, and then when you're famous, you can, you know, thank me, either orally or written, monetarily. Anyway, Frinkelia, I don't know of anyone who has ever missed this diagnosis. I think that they used to use it on boards because it's really the only genus that kind of does that. Multi-lobulated cyst in the intermediate host, and you do a higher magnification, and those are, you know, bunches of little bananas, just like any other coccidium. If it didn't have these lobules, it would be hard to tell what it is. Besnoitia, the Besnoitia sexual cycle looks just like the Eimerian stuff. However, it uses an intermediate host. Usually Eimeria doesn't, it's direct. Well, Besnoitia does, and these are asexual cysts. This happens to be an eyelid of a caribou, but it gets into skin, it causes some inflammation. But Besnoitia is important because it gets into a lot of animals. And the way that you diagnose an asexual cyst or accumulation in an animal is that these are the zooites, okay? And it incorporates the host cell nucleus. Now, is this an endothelial cell? Probably is an endothelial cell. I don't know if they've really ever mapped that out. But the organism not only causes hypertrophy of the host cell nucleus, it increases the number of host cell nuclei, and it kind of incorporates that in a little hyaline membrane that kind of nourishes the cells. Okay, look at these nuclei. They're much bigger than normal, and there's hyaline things around it, and I'm not going to go through the different hosts. But look at this. Is this not beautiful? Huh? This is Besnoitia, so when you see that, you'll know what it is. Now, this is a lizard, okay? Now, they say, what is that? Well, it looks like a coccidian to me. Well, which one is it the closest to? Well, I think it's the closest to Besnoitia, because, look at this hyaline thing, increase in size and number of the nuclei. You show me another coccidium that do that, we can put that in the differential as well. Toxoplasma. Everybody gets excited about toxoplasma because a lot of people have cats, and they're worried about the thing. Of course, toxoplasma, you all know the story much better than I. And this is a brain of a mouse, and these are the zooites. Notice how you don't hear me calling them tachyzooites and bradyzooites and stuff. This is my rule of thumb. And look where I am today. But anyway, the rule of thumb is you call them zooites. Huh? And then if somebody is cute, like one of my residents, and they'll say, well, Commander, is that a tachyzoite or a bradyzoite? Well, then you go, you have a 50-50 chance, you know, of being right. But these are tachyzoites, okay, I know that. But call them zooites, don't, you know, complicate life. And this is a PAS, and you go, well, gee, that's easy, well, use that on Histomonas too. Well, it's not always PAS positive, so you kind of have to watch that as well. But here they are in macrophages in the lung of a cat, and you look at this and you tell me it's toxoplasma, and I go, sure. And you can't see anything about it. And here's some, they're not banana shaped, they're kind of oval. So it can kind of look different. You know, it's a coccidian. I would say it's a coccidian, but you know, we don't know what other coccidia do. So what you do is you have this good EM technician, and you say, here, take some of this brain, let's do some EM, let's try to differentiate it from the others. And then you come up with something like this. And you have some apicomplexum organisms, which are found in a vacuole. You see this parasitophorous vacuole right here? This is to be contrasted with the Sarcocystis meront, you know, the merozoites and the schizoid and the endothelial cell, which are found touching the cytoplasm of the cell. So that's how you can tell toxo from Sarcocystis. And it's very important because if you want to publish a paper, the editor is going to say, well, did you do EM? Or did you do immunological stains and stuff? And most of us have the use of electron microscopes. But anyway, you'll look for this thing. Now, when I published my book some years ago, I forget time being as old as I am, but this was of undetermined taxonomic status. And we now know, I mean, 2 years later, my co-author publishes this as Neospora. And we now know that this is Neospora canis. And notice it has this nice kind of like thick cell wall in these neuronal bodies. And then we have things that we don't know what they are. I mean, this is a knot, some kind of bird. And there's really only been one outbreak of this little booger. And here are the organisms in endothelial cells. And notice how it causes hypertrophy of the endothelial cell. And it increases the number of nuclei. So you wonder, is this some kind of strange Besnoitia? I have no idea. Look at this. Isn't this pretty? And then you have strange things like this. When we published the book, this was unknown. And then one of my co-authors, I think that they waited for us to publish the book. And this was causing, I think it's equine protozoal myelitis, something like that. But anyway, I think it's now thought a species of Sarcocystis. Klebsiella. Well, Colonel Bunty told you everything about Klebsiella, you know, in the guinea pigs. Well, these are just some in horses. They're in tubule cells. I won't linger on it. But I want you to appreciate this sunburst, these sporoblasts coming off a residuum. And you can find those in epithelial cells. Here are the mature forms in a guinea pig. And look how they come off a little sunburst. You know, you have to appreciate the innate beauty of these little boogers. And these sporoblasts will then increase, the nuclei will increase, and then they'll form a little spore coat, and I think they're called sporocysts, and they pass out in the urine. I really don't get excited about Klebsiella. I do get excited about this little organism, and this is hemogregarins. The hemogregarins, another group of protozoans, and it starts off, these organisms are in erythrocytes, okay? And the erythrocytes kind of get lodged in capillaries, and then they start forming these things, and you think that these things are free, when in fact they're not. You really don't appreciate the erythrocyte, but it starts off with an asexual reproduction. Look, the nuclei get out on the periphery, and then they get more of them. And then the cytoplasm goes around it. Isn't that pretty little thing? And then they form these little banana-like things, and these pop out and get into an erythrocyte. Look at that nucleus of the organism in an erythrocyte. And these later get into, and they do the same thing. Nice organism, huh? Well, this is first cousin. This is Hepatozoan, and a different kind of group of animals. Huh? I think that this is all in the handout. I don't know. I think that this is in order. But anyway, look, it's doing just like your hemogregarins. Periphery first, and then they bud off from a residuum. And you know, they're massive numbers in spleens and livers of dogs. Here they are. These are mature zooites, and these come out and pop and get into mononuclear cells. And you can see these in your peripheral blood smears of dogs. Let's talk Plasmodium. You know, human pathologists think that there's only 4 species in humans, but I'm here to tell you that almost any group of animals has Plasmodium. You do a Giemsa stain, you see the red of the nuclear material, the cytoplasm, the pigment, pretty little things in peripheral blood. But they also have asexual schizonts in tissues. I mean, let's face it, the human forms have it. Why shouldn't the animal forms? So here they are in an endothelial cell breaking, and I choose to say they're breaking as opposed to the knife breaking the schizont. But anyway, here they are. This is in a turkey, capillary in the brain. And look at, you see, I'm just showing you this because all kinds of protozoans can make groups of nuclei in tissue. So you have to go through these differentials. Here they are. Look, here's one in a penguin. Now, can you tell that from Sarcocystis? May be difficult, huh? That's Plasmodium. And this is Hepatocystis in monkeys. And usually people never, miss this. It goes into the normal liver. And remember, these tiny little bitty zooites are liberated and go into erythrocytes where they later form gametocytes, which are picked up by arthropods. Well, they also form little ring stages first. Now, if you showed me this stage, and I would say, well, that's either Plasmodium or it is Hepatocystis, and you'd be right. Actually, it's Hepatocystis. But now look at this cute little thing. It's basophilic. It has a little red nucleus right there. But do you see how it's an applique form, as Plasmodium falciparum also often does? But you see that little vacuole associated with it? Huh? Isn't that great? Huh? Well, that isn't Hepatocystis, and it's not Plasmodium. It's Entopolypoides. Yes, I've seen 4 cases of this. But it's a strange little protozoan. It's not in the book, but you can differentiate it from both your Plasmodium and your Hepatocystis. Let's talk Tyleria. You people probably recognize Tyleria, not being from South Africa where it's prevalent, but Tyleria as cytoxoan. Felis, remember in the cats, and it was very in vogue to have cases of cytoxoan. Well, here we are. Here is in a macrophage a developing schizont. This is strange that the mature one has the tiny little things, whereas the immature one has the big nuclei. Here they go, immature, mature, and we once thought that they were in endothelial cells. Now, doesn't that look like an endothelial cell budding off? But we later find that it's probably in macrophages. And then they form these little zooites, these little, ring forms in the cat's peripheral blood. And that's Tyleria, which, of course, occurs in cattle as well. And Babesia, this is the only slides I would see. If they didn't get into tissue, it doesn't excite me that much. But here are your Babesias. All right, and this is a lovely parasite. This is Hemoproteus. And, I think Dick Montali told me that you can't find a pigeon in Washington, D.C. that doesn't have Hemoproteus. Actually, this is from Washington, D.C. And look, this is a sinuous schizont following the epithelium of a capillary. It's inside the epithelium. And these zooites break out. And look at these pretty little organisms. Look at multiply infected kind of thing. Leucocytozoan, first cousin, forms these megaloschizonts in the brains of ducks. I think that they've quit asking that question on boards as well. Nothing looks like this. And they do asexual reproduction in these little conglomerates. And these things pop out and form either round to elongate trophozoites in erythrocytes. These are both tissue sections. And then we have a whole group of hemosporozoans that we have no idea what they are. This is from Australia. Look at this. They said it was bamboo in nature. Look at that hyaline wall and all of these tiny little zooites. Here is a kiba, which is very closely related. Here is an organism that I reported 9 years ago from the Los Angeles area. I still don't know what it is, but look how it has sinuous kind of things, caused hemorrhagic myositis in quail and killed all the quail around a valley in Los Angeles. Here it is maturing. And then when the zooites are mature, look at the little septi, the compartmentalization. Blood rushed in, and then it infected the blood cells, and we still don't know what it is. And then these are two strange organisms from pigeons from Maryland.